Buenos días, buenas
Good morning, good afternoon from the headquarters of the Pan American Health Organization, PAHO, in Washington, D.C. Welcome to this press briefing on COVID-19 in the Americas. My name is Luciana Viegas, Public Affairs Advisor with PAHO, and today is Wednesday, December 15th, 2021. As every week, we do have interpretation into English, French, Portuguese, and Spanish, and journalists may use the Q&A button to send their questions. We have already received many questions via email. Thank you very much. Please remember when sending your questions to identify yourselves with your name, the media outlet you represent too. Today, PAHO's director, Dr. Carissa Etienne, will be updating us on the situation of COVID-19 in the Americas. We have with her Dr. Jarbas Barbosas, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director with PAHO, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19 with PAHO, and also Dr. Jairo Mendez Rico, Regional Advisor on Viral Diseases with PAHO. Today, I give now the floor to Dr. Etienne to share her opening remarks. Dr. Etienne.
Thank you, and good morning, and thank you for joining today's briefing. Over the last week, the Americas reported over 926,056 new COVID infections, which is an 18.4% increase in COVID cases from previous weeks. In North America, the US and Canada are experiencing a resurgence in cases as Mexico continues to witness a reduction in COVID infections. In Central America, cases are also down, except in Panama, where cases have steadily increased over the last month. We are seeing a shift in picture in South America. Cases have dropped in Bolivia for the first time since September, just as COVID infections increased in Ecuador, Paraguay, and Uruguay, and cases remain steady in Brazil and Peru. In the Caribbean, while infections are down overall, Trinidad and Tobago reached its highest weekly COVID case count, and cases rose by 66% in St. Lucia over the last week. Meanwhile, the Cayman Islands reported the highest weekly COVID incidence rate of any country or territory in the Americas. COVID does not simply go away, so we need to employ all the resources we have to stop it. Vaccines, masks, social distancing, and of course, surveillance. Today is our last press briefing of this year, so I'd like to take a moment to reflect on the second year of the pandemic, a year that marked us, challenged us, and gave us reason for hope. Since the start of the pandemic, more than 98 million people in the Americas have developed COVID, and more than 2.3 million people in our region have lost their lives to this virus. More than a third of all COVID cases and 1 in 4 COVID deaths reported worldwide have occurred here in the Americas. And when we compare 2020 to 2021, this year was undoubtedly worse. We saw triple the number of COVID infections and deaths in this second year of the pandemic than we did in 2020. Hospitals were stretched thin, vital medicines and supplies ran low, and our health systems were put to the test like never before. But while this has been a sobering year, we have learned what it takes to bring this virus under control. And thanks to COVID-19 vaccines, we have protected tens of millions of people from the worst of this virus. As we welcome 2021, COVID vaccines had not yet arrived on our shores. Today, more than 1.3 billion COVID vaccine doses have been administered in the Americas. Although rollout of vaccines has not been as rapid as we would have liked or as evenly distributed, today 56% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19, thanks to the efforts of countries and the support of donors. Some countries in our region, like Chile, Cuba, Uruguay, and Canada, have some of the highest vaccine coverage in the world. And yet, millions of people in our region have yet to receive a single dose. Vaccine inequity continues to divide our region. And if we don't address these glaring gaps, we'll fail to bring this virus under control. There is no magic bullet to protect us against COVID-19. That's why we must embrace new tools and use them wisely. Right now, there are a few promising new drugs in late-stage development that may help us treat COVID and thus avoid hospitalizations and prevent deaths. If they are approved by regulatory authorities, we must be ready to leverage these technologies, building on the lessons of the last 2 years. The first lesson is that every decision must be grounded in evidence. We urge countries in our region to heed the advice of the WHO expert committees, scientists, and regulators whose jobs it is to carefully review the safety and efficacy of drugs and recommend when, where, and how to deploy them. The second lesson is that we must be ready to deploy these tools once they become available. As new treatments gain final approvals, countries and companies alike must work together to ensure that everyone who can benefit from these tools has timely access to them at a price that all countries can afford. As we've seen with COVID vaccines, procurement and supply can be major barriers and keep innovation out of reach for those who need it most. So we cannot and must not let history repeat itself. And that's why we need to start working now to expand production capacity for these life-saving tools, including in our own region, so countries don't remain completely dependent on pharmaceutical imports. Although it is encouraging that some companies developing novel COVID-19 antivirals have pledged to make their products available at affordable prices in the world's poorest countries, we worry that many of the countries that have been hardest hit by COVID, including many countries in our region, do not qualify for these pledges. Without additional support, our countries, many of them, will be left behind. And PAHO is tracking this closely, and PAHO is on deck to support countries, international organizations, companies, and partners to find alternative solutions to guarantee access to future COVID therapeutic tools, including antivirals. This region has the technical expertise, a well-established manufacturing capacity, strong regulatory infrastructure, and an effective pooled procurement mechanism via our strategic fund that, if effectively leveraged, will help us accelerate access to COVID technologies. But for this regional effort to work, we need the goodwill of companies to openly share these technologies and resources to all countries so that the Americas are not left behind as new tools become available. One of the most important lessons this pandemic has taught us is the importance of solidarity and of working together. Effective collaboration across borders enabled vaccines to be developed in record time, variants to be identified quickly, and countries to adjust their responses based on the latest available evidence. Each time we worked together, we had breakthroughs. But when countries worked in isolation, when innovations and resources were not shared, we created space for the pandemic to thrive. Sharing is central to defeating this pandemic. And that's why I want to end today's speech with a special thank you to the reporters that are tuning in today and have tuned in over the last year. And to all the journalists who've covered the complex COVID-19 pandemic developments. By sharing information, you have helped people around the world understand the latest evidence to keep themselves and their loved ones safe. So we count on that same spirit of collaboration as we start 2022 with renewed energy to defeat COVID-19. Thank you so much.
Gracias, doctor Etienne. Perdón, los periodistas.
Dr. Etienne, thank you very much. We apologize for the noise. We give the floor to Dr. Sylvain Aldiguieri.
Newspaper asking about the situation of Omicron in the Americas and what we should keep in mind to avoid an outbreak. Dr. Aldiguieri, perdón.
Thank you for this question from the Nikkei correspondent based in Mexico. First, I would like to highlight that thanks of the active participation of most of the national public health laboratories in the PAHO regional genomic surveillance network, we have been able to follow the distribution and circulation of different SARS-CoV-2 variants, and this during the last year. The network is supported by 7 regional reference laboratories that cover North America, Central America, South America, and the Caribbean. So far, the Delta variant is still predominating in all the subregions of the Americas. As of today, the Omicron variant has been detected in 9 countries and territories of our region: the USA, Canada, Mexico, Argentina, Chile, Brazil, Cuba, the Republic of Trinidad and Tobago, and Bermuda. And Omicron detected in our region has been mostly associated to travelers. Nevertheless, sustained community transmission data is still very limited in our region. It is necessary to always have in mind that the outbreaks and increase of cases are triggered by a multifactorial process. Variant circulation is only one of those factors and may not be even the most important one. At this exact moment, as we analyze the growth rate of the Omicron variant in some countries of the European region and the existing spread of the Delta variant across our regions in the Americas, it is important to remind ourselves the basics of the readiness of health systems and the basics of the operational response to the pandemic. Regardless of the variants circulating, all the public health measures already implemented to limit the transmission of the virus, including the social distancing, including the systematic use of masks in closed public spaces, and of course, including the vaccination campaign to reduce the risk of severe disease and death, all these public health measures are working. These are extremely efficient measures when strictly implemented. And therefore, these measures should be maintained and reinforced, including reaching the unvaccinated population at risk and complete the vaccination scheme according to the national regulations. Thank you.
Thank you very much, Dr. Aldiguieri. Next question we have is from Stephanie Nolan, the global health reporter at the New York Times. Stephanie asks, what we know and can predict and should worry about regarding the Omicron variant and the Chinese-Russian COVID vaccines and implications for areas of the world that relied heavily on them. Dr. Barbosa?
Thank you for this question. Let me first make a comment that I think that it's not the best way to describe a vaccine, to call the vaccine by the country that developed and is producing the vaccine. Let me tell you that we have 2 Chinese vaccines that have the emergency use listing authorization from WHO. So they qualified as vaccine that have at the same time the quality of production that demonstrated with clinical trials and the other research that they are safe and that they are efficacious. So I think that it's important first to keep on vaccinating, as our director and I think Sylvain also mentioned. The most predominant variant now in the Americas is Delta. Let's not be concerned against Omicron and stop vaccinating. We need to keep moving vaccinated. In many countries in our region, we need to increase the coverage in order to protect the people. Secondly, the strategic advisory group of experts on immunization, that is the independent body of experts that make recommendations for PAHO, is reviewing very carefully all the evidence. We still don't have any evidence that is showing that these vaccines will not work against Omicron. Of course, that we can have some difference in the effectiveness of the vaccines when we have a new variant. This happened with Delta, but the vaccines combined with public health measures are still the best way to protect people against all the variants that we know. So let's wait. When we have solid scientific evidence, says we will make the recommendation. We will share this very rapidly with the countries, but let's not at this moment to predict, because it is impossible to have any serious prediction about this kind of behavior, and this can raise some concerns or rumors against vaccines and be a barrier for people to get in their vaccination. Thank you.
Thank you, Dr. Barbosa. La próxima pregunta.
So the next question in English also.
Media, Trinidad and Tobago. He asks, there are reports that the Omicron variant is mild. How does it compare to Delta? And if it is mild, will it affect hospitalizations and deaths if it becomes a major variant in a country? Dr. Aldigueri or Dr. Mendes Rico, please.
I may start on this question, Luciana. And regarding the reports of mild disease following infection by Omicron in the African region, I'd like to use a very cautious approach regarding these anecdotal and preliminary reports in a very specific context. In this regard, PAHO experts are doing a very close follow-up on the information shared by some European countries, including the UK, where the growth rate of Omicron is putting a stress on health services in some areas of the country. We have different scenarios on the table. The co-circulation of both Delta and Omicron variants during the coming weeks and months is one of them. But in all scenarios, countries should prepare for strengthening their health services for a higher influx of patients when we see the trends going up. I hope I have answered the concerns of the journalist in Trinidad and Tobago. Thank you.
Thank you very much, Dr. Aldigueri. Pasamos a la pregunta sobre
We move on to the question on the Christmas context and the end of the year holidays. And Chris Vilches from El Comercio in Peru is asking and also commenting on an increase in the number of cases among vaccinated patients? Does PAHO think that this is a situation susceptible of a new outbreak whenever we're talking about attendance to entertainment centers, gatherings in these Christmas times, and also coming from
restrictions ahead of the Christmas season, which is quite festive? What does PAHO recommend to countries at this time? Dr. Tien?
So let me thank you for this question. Of course, the holidays are a time of joy and celebration, but we must continue to be very careful this year not to get infected with COVID-19 during our festivities or even our family activities. We know that there are public health measures that work to prevent infection. And people should heed the recommendations of their public health authorities. You've heard us, several people already mention this. Most importantly, we believe that people should get vaccinated when it's their turn. And they should always wear a well-fitting mask when you're around other people. And stay at least 1 meter away from others. Even where restrictions are relaxed, we must exercise caution by avoiding what we like to refer to as the 3 C's. Stay away from closed spaces with poor ventilation. Avoid crowded places with many people nearby, and avoid close contact settings like face-to-face, close-range conversations. The risk of infection and outbreaks increases when these 3 C's overlaps. So please protect yourself by not going to crowded parties and evaluating your risks in shopping centers or closed spaces. Wear a mask, and when possible, open windows to ensure air circulation. I just want to stop to say, wearing a mask it means wearing a mask properly, because we see people with masks, but we see the mask are below their chins or below their nostrils. So we need to wear masks properly. Wash your hands frequently and don't touch your mouth, your eyes or nose with unclean hands. Let's remember that the pandemic is not over yet, and we must remain cautious, vigilant, and safe. We have seen the Delta variant predominate, and now we are looking at Omicron and what's going to happen there. But there may be others. But the important thing is the same tools work against all of it, all of the different variants. The best way to fight this and all the variants of SARS-CoV-2 is for countries to continue working to vaccinate all eligible populations and to continue to promote those public health and social measures that can limit transmission.
Thank you very much, Dr. Tien. Next question from Jasmine Brown from Nassau, from our news reporter in the Bahamas. Jasmine asks, the Bahamas began administering boosters, 3rd shots of COVID-19 on Monday. Yesterday, a Pfizer executive said is likely that a 4th shot will be needed in less than a year. What is PAHO's view or recommendation on this, especially considering vaccine equity remains a concern in the region? Dr. Barbosa?
Yes, thank you, Jasmine, for this question. First, I think that's very important to recognize the effort that the Bahamas and many other countries are making to increase the access of their population to vaccines. The Bahamas is moving forward very fast. It's now around 36% of their population fully vaccinated. So following the recommendation that PAHO has made, it's very important to increase the coverage in the population and to make the 3rd dose for that groups that the WHO and PAHO are recommending. People that receive Sinovac or Sinopharm vaccine and they are at 60 or older, and for any vaccine, people that are immunocompromised. For the other vaccines, they really don't need at this moment. A 3rd dose is much more important to use these doses to increase the coverage. About this About the recommendation of the Pfizer executive, we really cannot make any comment about that. We cannot rely on press briefings made by CEOs or companies. We need to have real scientific data. The scientific evidence will be the basis for that group that I mentioned at the beginning, the strategic advisory group of experts on immunization that makes the recommendation for WHO and PAHO. They need to review scientific evidence. It's not a speculation for one person or other person. This will not provide good recommendation for the Ministry of Health, and maybe they will spread some confusion among the population. So it's better to wait to keep on vaccinating with the vaccines that are available, because they will protect against the Delta variant. That is the most predominant variant in the Americas. Is Delta variant who is producing severe cases that are hospitalized in ICUs, that people that are dying. All of these now are related to Delta variant, and the vaccines work for Delta variant. So let's keep with the recommendation that you have. Let's review carefully the new evidence that will be produced in the following weeks to make recommendations that are really based in scientific evidence. Thank you for this question.
Thank you, Dr. Barbosa. A follow-up also from Jasmine Brown, from our news reporter Bahamas, on schools. She's asking, public schools will welcome students back to the classroom for face-to-face learning. What is PAHO's views on kids returning to the classrooms? Dr. Ugarte?
Thank you for this important question, because many countries are considering reopening schools. Let me begin with a position that not only WHO, but PAHO and many countries have adopted. The continuity of education for children, for their overall well-being, health, and safety should be at the forefront of all considerations and decisions that are being taken in this context of pandemic, COVID-19 pandemic. So the reopening, opening and closure of schools have been in-person, educational activities have been addressed by PAHO and WHO through guidelines, but also as part of a comprehensive sets of public health and social distancing measures. And there is a specific document that details how these measures can be implemented, considering the different local epidemiologic situation, but also what is the capacity of responding to increase of number of cases and taking into account, of course, also the emergence of variants. For instance, at situation level when there is a community transmission with limited additional capacity to respond, childcare services and primary and secondary schools may remain open with adequate safety and surveillance measures in place as long as the local context allows. But in situations when there is an uncontrolled epidemic, that's in that case is the situational level 4, with limited or no additional health system response capacity, all individuals, including the fully vaccinated, partially vaccinated, and recovered individuals, should stay at home and limit physical contact with the people outside the household. That is the situation also, of course, for schools. Therefore, we consider that the decision of the Bahamas to resume in-person learning seems to reflect the consolidation of the collective learning process that we have been going through these past 2 years, but we trust that the educational institutions are fit to ensure adequate ventilation, to maintain physical distancing, and to allow hand hygiene. Protocols for the use of masks are also developed and implemented, and arrangements are in place between the health and education authorities for the early detection and management of cases in school settings, as well as the identification and follow-up of the contacts. So there are many criteria that I would like to highlight, And in countries where there is intense community transmission and settings where physical distancing cannot be achieved, so there are certain additional recommendations, including the use of masks in schools, that must be implemented. So while PAHO and WHO technical guidance for safe in-person learning is available, the utmost priority for national and local authorities should remain the suppression of transmission, and hence the protection of health services and saving the lives of the people that are being affected by COVID-19 and other diseases. This obviously implies the complex decision-making processes, including all the implications and related to continuing or interrupting the in-person learning. So the safety of the children, the teachers, the personnel, school personnel, but also the entire community is at stake. So those decisions must be carefully taken and follow up. Thank you.
Thank you very much, Dr. Ugarte. Pasamos a una pregunta de Jacqueline Villeda, Diario El Mundo en El Salvador. Dos preguntas. La primera pregunta,
Two
Jacqueline.
question from El Salvador, from Jacqueline. What is PAHO's opinion that countries such as El Salvador are not requesting a negative PCR or a vaccination card when people coming to the country, given the new variant of concern? Second question is, do we know when was the last time that El Salvador sent tests to be sequenced and detect the circulating variants? Dr. Aldeguerri, over to you. Thank you very much for your question from El Salvador. Let me start with the first part of the question, and then I will turn it over to Dr. Jairo Mendez Rico, who is our leader in our team for our labs, and he is the regional advisor on viral diseases. To this point, WHO PAHO recommend that countries should determine their measures related to international travel according to an approach which is based on risk. Risk-based approach means that according to the epidemiological situation and the response capacity of the country, once a country defines their threshold of tolerance for risk vis-a-vis the introduction of cases of infection due to SARS-CoV-2 virus, including its variants, in this context, authorities may decide to adopt or not adopt some mitigation responses related to international travel, as long as decisions are made taking into account their response capacity. And if they maintain international traffic active, that international travel, which is essential, deemed essential. These measures may cover a broad spectrum from closing borders, invoking the precaution principle, or on the other hand, deciding not to adopt these measures. It's important to say that WHO PAHO does not recommend to require evidence of vaccination as an exclusive condition to allow international travel, given the limited global access and the inequitable distribution of vaccines against COVID-19. This position is also in agreement with the equity principle, which is the inspiration of the current international health regulations. PAHO recognizes that countries may resort to requiring proof of vaccination for international travelers who will then be waived other requirements to leave or get into a country. For example, results of lab tests and quarantine. After having shared these few points with you, I will now turn it over to Dr. Mendez Rico, who will better describe the aspects related to labs and surveillance. Dr. Mendez Rico, thank you very much, Dr. Altiguene. Thank you for your question regarding the lab tests for international travelers. So let me tell you that at PAHO, we have never recommended to do PCR or antigen tests or other tests as a requirement to enter a country, regardless of the variants that are circulating. This is not an efficient measure because even with very sensitive techniques such as PCR, a negative test may be seen in a person who, even though this person may be infected, is at a time in the infection where the virus is in incubation, and so it has no non-detectable levels. So a negative result prior to a travel does not preclude the possibility that the person is infected by the time the person reaches their destination. In addition, there can be a sense of false security that will lead to relaxing public health measures, and therefore efforts should be focused on implementing public health measures of control, such as physical distancing, social distancing, use of masks during the travel, assuming the inherent risk of receiving travelers from different parts of the world. Regarding genomic surveillance in El Salvador, thanks to their participation, we have been able to sequence samples until the month of November. In cooperation with the Gorjas Institute in Panama, which is one of the labs in the um, uh, network of surveillance labs, and the Delta variant has been identified there as well as in other parts of the America, with sporadic detection of Lambda and Mu and other variants that are common but in very low proportions. Thank you very much. I hope I have answered your question. Thank you, Dr. Mendez Rico. Now, so from Matias Luvi in Spanish, also from testing. After 2 years of pandemic, almost, there is still confusion about what is the adequate time to do testing in people with symptoms or close contacts. Should we wait 72 hours from the initiation of symptoms from a confirmed contact, and thus reducing risk of false negatives? I don't know. Dr. Ugarte, would you like to give us some comments in this regard? Yes, thank you very much. And I'm going to ask Dr. Jairo Mendes to comment regarding taking of samples in asymptomatic patients or in close contacts. Let me start by saying that WHO and PAHO's position regarding testing in asymptomatic individuals is recommended only for specific groups, including contacts of confirmed or probable cases of COVID-19 and those exposed frequently, such as health workers and people who work in long-term facilities. So there's no document from WHO PAHO where it says at what point in time you should take samples in close contacts. But what makes sense in all of this is that if there's a person who is in contact or yes, is in contact with someone who has had confirmed COVID-19, they need to be in quarantine immediately. And if they have symptoms, samples should be taken as soon as possible, and the person should be in isolation. These are the aspects that should be underway, and taking samples for PCR, for example, in asymptomatic patients has led to increasing a demand for these tests, and thus it has reduced the capacity of labs to process the samples and inputs and reduces the amount of inputs that would be available, should be available for people who truly need them. So if a person has a symptomatic, they should do the test as soon as possible and protect their environment and limit transmission. That is the answer. So now over to you, Jairo, for additional comments. Thank you. Thank you, Dr. Ugarte. We need to take into account the viral dynamics. And when the symptoms are generated, the virus maybe has been several days, at least 48 hours before, either detectable or not, before symptoms initiate. When symptoms appear from the first day onward, and as close as possible to the first day where symptoms appear. So from the day one to day three, we can detect over 80% of the cases using the techniques that we have available for testing. So the message for people who are symptomatic, do the testing as close as possible to when the symptoms are detected or appear. Now, regarding contacts, we do not recommend the use of these technologies for asymptomatic contacts because, in fact, there is no measure that really allow us to determine whether a person, even if they have been with a positive infected person, really was able to replicate the virus. So it's maybe I can start taking tests and they will all be negative, but I don't know whether it is that the virus is in incubation, or if the virus is not there. Uh, this can lead to a sense of false security, allowing me to think that I don't have the virus where I may be incubating it. So the best time to take a sample, if a person is asymptomatic, there is no way in which we can measure that time. And in that sense, definitely, we really do not recommend to have tests, as Dr. Ugarte said, because what he said, we will be spending precious resources that might be necessary for someone who really needs the test. Thank you. Thank you, Dr. Ugarte and Dr. Mendez Rico. Now, question from Venezuela, or two questions from Venezuela, from Contrapunto and Mariana Sofia Garcia from Crónica Uno. They want to know what are the actual numbers of vaccination against COVID-19 in Venezuela. And the second question, the Cuban government, the question is whether the Cuban government has already started the process to register Abdala and Soberana, or are they still just vaccine candidates? And in Venezuela, the government insists in using the Abdala and Soberana vaccines in children. Is there any recommendation by PAHO regarding this, Dr. Barbosa? Thank you very much for your question. The first question, all weeks, countries send to PAHO the vaccination data. So we have no other alternative sources. These are the data sent by countries. And you can check our chart, which is available and which is updated every week. And this chart shows today that Venezuela has about 36% of the population already fully vaccinated, and 53% of the population, about 53%, has received at least one dose. But these may be data we received last week and which have not been updated. So it is up to the Health Ministry of Venezuela and other ministries of health of the Americas to provide the most update information. The information we put on our charts are those provided by the countries on a weekly basis. Regarding the Abdala and the Soberana vaccines, yes, last week the manufacturers of these vaccines sent an official package to the World Health Organization with the intention to initiating the process to receive the EUL, emergency use listing authorization. It is a long process, several weeks. Everything needs to be reviewed, quality of manufacturing, safety, effectiveness, data, as is done for all vaccines. It's a positive step that Cuba has already officially requested to initiate the process, and this means that we will have more vaccines that have already received the EUL. Regarding the use of vaccines in children, it's always important to say, as we say here, that every country does their own assessment through their own national regulatory authority regarding the information submitted by manufacturers, and then they make a decision whether to authorize the use of a vaccine or not. We don't have any data of the vaccines that are being used in Venezuela to confirm or affirm that they should be used in children. What we do is follow the recommendations by the SAGE, the strategic group of experts from WHO, and they are still reviewing some data from manufacturers requesting authorization for use in children, but that review has not been completed. So some countries who already have that information, maybe they can do their own review and give their own authorization at national level. Finally, we need to remember that priority groups are older adults, adults with comorbidities, and then all the adults, all the rest of the adults. These are the priority groups because that's where the largest burden of deaths and serious disease. So it's important to first verify that all groups of a country, all priority groups have been protected, and that each country, each health ministry has that information available to them and follow their recommendations. Thank you. Thank you, Dr. Barbosa. Now, questions from Mexico. We have many questions, and let's begin with Blanca Valadez from Milenio and also Melina Ochoa from Uno TV. The question is, what is the RO, the reproduction rate of Omicron as compared to other variants, and how many cases of Omicron are there in Mexico? Is there already community transmission there? Dr. Aldigueri. I'm going to start my my part of the answer, and then I will yield the floor to Dr. Mendez Rico, who will give some other points. So far, one case reported confirmed of the Omicron variant has been detected in Mexico. The health secretariat is closely following other signs through the Sentinel network and the consortium of the genomic surveillance labs which exist in Mexico. And therefore, we foresee additional imports imminently, as has been seen in other countries in the world. And the Mexican federal authorities will timely let us know. Dr. Mendez Rico, over to you if you would like to complement these points. Over to you. I'm sorry, my mic was muted. Okay, let me say this regarding the R0 or RO. Yes, these studies are being done. So far, what has been determined with Omicron is that it can have a high rate of transmission, 2 to 3 three times higher than other variants such as Delta. However, we still have a lot to research before we can be able to determine the impact of Omicron. It's too early to mention the impact that Omicron may have in our countries. Let me remind you that Delta, for example, had a dispersion capacity and a velocity of dispersion, which is very different than found in other countries. So we really don't know how the variant is going to behave regarding cross reactivity and prior infection with other variants. And this maybe could lead to different ways of responding. As we've said before here too, at this point in time, in terms of vaccines, of course, we know that in general, all vaccines will be slightly affected, which has been seen with other variants as well. So we already have this information, we know this, but the most important thing is that vaccines, regardless, continue to be very effective to protect people against serious disease and death. And for this reason, at this point in time, regardless, I repeat, of these small changes in the capacity to prevent transmission, vaccines continue to be the best tools, and we need to continue to use them. And finally, regarding the epidemiological situation, for the pointed for the, to make the a response to the Mexican question, there is a tendency to a decrease, and however, there have been some cases reported. Thank you. Thank you, Dr. Mendez Rico. And now Laura Barros from Agencia EFE asks, several countries talk about vaccine reinforcements or boosters, but what is the situation in Haiti, Nicaragua, and other nations where there are very low levels of vaccination? What is PAHO saying in this regard? Dr. Barbosa, thank you for your question, Laura. Our recommendation always is to maintain the our recommendations based on the best scientific evidence we have. We cannot start changing recommendations or making new recommendations without having all the evidence before all the necessary evidence that the different groups of experts from WHO and PAHO are reviewing. So our recommendation right now regarding third doses continue to be the same that have been recommended, and it is to use it for immunocompromised people, not for Omicron, but for Delta. The sound scientific evidence we have for people 60 years, over 60 years of age, they need a third dose if they have received Sinopharm or Sinovac, because the immunity begins to decrease. So these people over 60 having received these vaccines should also receive a third dose. Now, for older people, for immunocompromised people, boosters can be offered, even though the difference between the first and the third dose is not very significant. So it is necessary to be rational in using the number of vaccines we have available, and to guarantee that all countries may continue to increase the number of vaccinated population. The situation in Nicaragua has changed in a positive way, and it is important to recognize the effort there. PAHO has worked with the government of Nicaragua. They have mobilized through COVAX donations from countries such as the United States, Spain, Japan, and others who have provided vaccines to Nicaragua. And thus, the population which is fully vaccinated is close to reaching 40%, which is the goal established for the end of this year. The situation in Haiti is still quite critical. Haiti had many problems this year during the first half, earthquakes and many things during this year. And so their vaccine coverage continues to be very low in Haiti. Now more doses will be arriving in the country, and we are supporting Haiti's health ministry so that they can have more efforts to vaccinate, more participation of the communities and health professionals, so that they can reach at least protection of the most vulnerable 20% in Haiti, and administer vaccines to avoid deaths in case there is a wave, a significant wave of transmission of the infection in the country. Thank you very much. So now we are left with questions about Omicron. Melina Ochoa from Uno TV asks if Omicron um, avoid is if the vaccine is not AstraZeneca vaccine is not good for Omicron. Well, here's the thing: when we have a new variant, and we've already discussed this, what happened with the Delta variant, for example? If you can verify that there was a small we can verify that there was a decrease in effectiveness of vaccine to protect against moderate infections, mild infections. But the capacity of vaccines to protect is serious cases and deaths. And this is what happened with Delta. And this has been seen in results of many studies that have been carried out. At this point in time, there are groups of virologists and epidemiologists reviewing cases from Africa, especially South Africa, where they have more data and where they have significant transmission of Omicron. And other countries have cases, but these are cases that are not epidemiologically significant as yet. Most of the cases, 99% of the cases, continue to be of Delta. So please don't listen to rumors. We need to wait and see still to have a consensus evaluation. Today, we had first meeting from the group of experts of WHO, and we will shortly have information that we will be sharing with the countries through the health ministries and with the population based on scientific evidence, which is sound. Thank you very much. Thank you, Dr. Barbosa. This is almost the end of our session from Laura Bacos from Agencia EFE. She wants to know whether we have capacity in the region to quickly detect the entry of variants such as Omicron. Dr. Aldiguera, maybe you can comment on this. Yes, briefly, I have touched upon this when I was answering the correspondent of Nikkei based on Mexico. The region of the Americas has a regional network of genomic surveillance, and the work started with the influenza virus, then with yellow fever, and then we adapted it to SARS-CoV-2. And we have 7 regional laboratories, reference laboratories covering all the sub-regions of our region, North America, Central America, South America, and the Caribbean. They are all interconnected. And in addition, we have a national capacity that is being developed to sequence SARS-CoV-2. And with those tools right now, the countries are able to confirm, request support through the network to detect variants of concern, variants of interest, including the Omicron variant. I hope I have answered your questions and concerns. Thank you very much.
Roundup question, as the year comes to an end, how is the region doing in terms of vaccines, and what is PAHO's outlook for COVID-19 vaccinations for the next year? Dr. Etienne?
Let me thank you for this question, an important one as we come to the close of 2021. What is very clear is that vaccines have saved millions of lives and prevented millions of hospitalizations. But it took a massive effort. We strengthened national immunization programs to prepare for COVID-19 vaccines with new cold chain equipment, national surveillance systems strengthened, electronic registers, and regional networks. More than 598 million people in the Americas have received a complete schedule of COVID-19 vaccines, including the doses received through the COVAX mechanism or doses bought directly by countries. To date, more than 73 million doses of COVID-19 vaccines have been distributed in the Americas using the PAHO's revolving fund and the COVAX mechanism. We have seen generous donations from the United States, from Spain, Canada, and other countries that allowed COVAX to deliver nearly 20 million additional COVID-19 vaccine doses to the Americas. And these donations are set to continue into 2022. So through these efforts, 32 of the 51 countries and territories of the Americas have already achieved the WHO global target of 40% vaccination coverage by the 31st December of 2021. And we believe that many others will reach this goal in the next few weeks. However, we cannot forget the remaining 19 countries and territories that have yet to reach the 40% vaccination coverage target. Haiti, Jamaica, St. Vincent and the Grenadines, Guatemala, French Guiana, St. Lucia, and Montserrat all report coverage rates below 30%. PAHO therefore will continue to provide very close support to these countries so they too can achieve the global targets and protect their populations. Vaccine availability at the global level has increased in recent months. And PAHO's revolving fund is collecting commitments from member states to procure additional vaccine doses directly from manufacturers. So this offers another procurement option at what we think are more competitive prices to our countries. Deals have already been reached with AstraZeneca, for Janssen, Sinopharm, and Sinovac, and negotiations are well underway with an mRNA vaccine provider, and those negotiations are in their final stage. To bring this pandemic under control and to avoid future social and economic catastrophes, countries must redouble their efforts to reach all persons at high risk and to provide a complete vaccination series. One dose is not going to, of a 2-dose or 3-dose regime is not going to protect all peoples. And PAHO is already providing support in evaluating the vaccine introduction efforts, in collecting lessons learned, and updating the national vaccine deployment plans to ensure that we have equal vaccine access across the region. And this is extremely important. But PAHO is also thinking ahead, and we're addressing the limited production and the unequal distribution of vaccines in the Americas by, as you've heard before, developing the regional hub to produce mRNA vaccines in the future. These investments, we believe, will serve the region well for both routine immunization services and in the event of future epidemics and pandemics, then that would be available as well. So 2022 should be a better year for vaccine supplies in the Americas, but there are still some concerns. First, we need more vaccines for our countries, and we've repeated that over and over again. We've made efforts to get more vaccines into our countries. We need more vaccines for our countries. Second, we are concerned by trends in some countries that are expanding vaccine eligibility to younger age groups before they achieve the high coverage among the vulnerable groups of health workers, the elderly, and persons with comorbidities. And these gaps can be especially large in remote areas and in populations living in situations of vulnerability. So this is a challenge that we must address, and all of our countries must engage around this. Our other challenge for 2022 include developing communication strategies to improve vaccine acceptance, expanding our reach so that all communities feel engaged in the fight against the pandemic, and to address the worries of some health workers so that they can become advocates of the COVID-19 vaccines for their own patients and their communities. And many countries have already launched effective communication campaigns to increase vaccine demand among the unvaccinated. And PAHO continues to create tools and resources to help countries develop and implement risk communication and crisis communication plans to combat the misinformation that is so widespread, and to provide individuals with trustworthy information, and importantly, to address their concerns. Also, PAHO is working with journalists across the region to identify misinformation and to report from reliable sources. We close our media briefings this year. Let me again, on behalf of PAHO, reiterate our thanks to you journalists and media personnel, our partners and collaborators, scientists and researchers, healthcare workers and other responders, community organizations, civil society, and all those who are working together tirelessly to end this pandemic. Let me take this opportunity to wish you a happy and safe holiday and to extend our very best wishes for the year 2022. And see you next year. Thank you.
Thank you very much, Dr. Tien, for those final words and the outlook for next year. Colegas, llegamos ahora al final de nuestra sesión de hoy. Como mencionó la directora, es la última del año.
Colleagues, we have reached the end of today's press briefing. This is the last press briefing of the year. We are coming back in January. We are open to receiving questions and concerns. You can send that to mediateam@paho.org. And again, we will keep you updated on the epidemiological situation, on weekly updates on the situation in the Americas. I would like to thank the journalists that were with us throughout the year and also our technical staff that made this broadcasting available and possible. I would also like to thank our interpreters, and I wish you all happiness and see you again in 2022 with good health. Thank you very much.